This is our Instadose dosimeter. It measures and stores the accumulated radiation dose. It uses the direct ion storage technology. We obtain readings using the Instadose platform, and we do that weekly. We wear them at thyroid level whenever we're in the hospital, especially when we're taking radiographs, and we're going to wear them outside of the gown whenever we are taking radiographs. The maximum permissible dose is 5,000 milligrams per year. Here we are reading Deanna's Instadose dosimeter. Her year to date is 0 milligrams. Her lifetime to date is 21 milligrams. So she is well below the yearly maximum permissible dose, which is 5,000 milligrams per year. This is where we keep our PPE. We want to always inspect each and every piece before we wear them to make sure that they don't have any new unreported holes or tears, so that we can make sure that they are not torn at the actual lead protection part. So this is the lead gown. We wear it across our bodies at the front. It clicks in here. The dosimeter will also be worn at thyroid level outside of the gown. This is a thyroid scarf, will be worn around the neck. And then we have lead gloves. The fingers should not be sticking out of the holes. They should be in the glove completely. And there are also lead-lined glasses for eye protection as well. There are 3 methods of restraint in radiology. There's physically holding the patient in position while taking the radiograph. There's chemicals such as sedation, anesthetics. It reduces stress and movement of the patient, as well as exposure of the animal and the personnel. And positioning aids such as a V-trough and foam wedges and tape and gauze. Some examples of positioning aids are a V-trough, a string of gauze, or you can use tape, and foam wedges. We don't have foam wedges here, but we can often use towels in place of a foam wedge. We can also use physical barriers while we are taking radiographs. If the patient is under anesthesia, we can use the wall behind the x-ray suite. While the patient is in position under anesthesia, we can take the pedal and go behind the wall and then make the exposure. Distance and exposure time can be used as safety measures as well. The farther you are away from the patient, the safer it is for you. It's especially easier when the patient is under anesthesia. The inverse square law states that doubling the distance away you are from the animal decreases the intensity of the beam to 1/4 of the intensity. The time is also used as a safety measure. You want to use the shortest time possible as well, still obtaining diagnostic films. Decreasing the time decreases the amount of electrons produced because you're lessening the amount of time that the anode is positively charged. No portion of any personnel should be exposed to the primary beam, even if you are wearing the PPE. It only reduces the primary beam by 25%. To follow ALARA guidelines, we want to make sure that all non-essential staff have left the x-ray suite before making an exposure. ALARA guidelines state that if we have the fewest number of people necessary to take an x-ray, we'll have the lowest possible exposure to radiation. In doing this, we also want to make sure that we get a diagnostic image on the first exposure, which means less exposure to the personnel and to the patient as well. In order to do this, we make sure that all of these settings, according to the technique chart and the patient positioning, are correct the first time. People who are under 18 and women who are pregnant have certain restrictions from helping in x-ray. Radiation is most affecting on rapidly reproducing cells, So people who are under 18 are excluded from all radiation assistance, and women who are pregnant must have a written agreement and a visit from their physician to make sure that they follow all the strict guidelines if they are pregnant and assisting in radiographs.
So we're going to do craniocaudal radius ulna. So you go into cornerstone to the patient's name and go to imaging request. And item ID is going to be RAD1 for one view, digital radiography, and then you select front right extremity and DP radius ulna right. Then you go into IDEX PACS and her name should pop up. She's 27 pounds, so we're going to use this chart here. We're at extremities 20 to 40, so KVP is at 66, MAS is at 5, and MA is at 400. So we're going to set here to 66 KVP, or I'll do it. 66, and then 5 MAS, and 400 MA. So we're going to position her. Dawn, you can pick her up into ventral recumbency. Ventral recumbency. Here. And then hold her head away from the affected leg. You hold her head here. Oh, let me hold on. Pause for a second. Ugh. I'm going to use, it's okay, I can edit it. I'm going to use a piece of gauze to extend her affected leg cranially. And then we're going to center at the midshaft of the radius ulna. And then collimate proximal to the elbow and distal to the carpus. And then the right marker is going to be lateral to the radius ulna. VD thorax on Barley. We're going to go into cornerstone to her account and request an image. We're going to select one view in digital radiography to canine, thorax, VD. And her name will pop up here. And then we're going to set the machine. She's about 27 pounds on thorax. So she's between 20 and 40. KVP will be set at 82. And then MAS will be set at 5, which it is. And then MA at 320, which it already is. Now we're going to place her in dorsal recumbency. Good. We're going to center the beam midline at the caudal border of the scapula. And then I'm going to use these towels to keep her body from rotating. Farley, stay. Farley, stay. then I'm going to collimate cranially at the thoracic inlet. I'm just going to go down a little bit. And then caudally stay at the first lumbar spine. Just a little bit. There. Barley stay. Okay. And then the right marker next to the axilla. Oh, barley stay. And then I'm going to extend her forelimbs cranially as far as possible and her hind limbs caudally. Barley stay. Now we're going to do VD pelvis. Go into image request. Grab 1-for-1 view. Digital radiography. Pelvis. Extended VD. So this I'm going to use a V trough. Her in dorsal recumbency with the V trough under her thorax. I'm actually going to trade you spots though.
You're okay, Don. You're in this too.
Towels are going to act as a foam wedge to keep her body from rotating. We're going to center the beam at the ischial tuberosities here, at the midline here. And then we're going to collimate cranially at the crest of the ilium and distal to the patellas. And then laterally at the greater trochanterus. And the right marker is going to go cranial to the pelvis. Here. Our chart here, pelvis, 20 to 40 pounds, so KVP is at 80. And then MAS is at 5, and MA is at 400, sorry. So Dawn is going to extend the forelegs cranially, and I'm going to extend the hind legs caudally, while keeping them parallel and even to each other. And then I'm going to rotate the stifles medially and keeping them even and parallel to each other and to the table. And then the patella is going to stay over the trochlear grooves. That looks better, right? I'm going to retrieve an image for one patient in IDEX PACS. I'm going to open up IDEX PACS here in the search bar. I'm going to type in the patient's name, which is Marcello. Hit enter, and then we see all of the Marcellos that we have here. This is the Marcello that I'm looking for, Marcello Howe. I'm going to double click on the image.
and he will pop up here.
So we're going to do a barium series of the esophagus. The patient is already in position. I'm going to give him the barium sulfate. Good boy.
Good boy, Salty.
Good
Good boy, Salty.
Good boy. Good boy. Okay, let him swallow that down. And then immediately take the exposures.
I'm Ann Lewis. I'm also known as Candy, as you can see from my smock. I'm the veterinarian here at Harmony Animal Hospital, where Charlene Novolosa has been doing her preceptorship, and she's a valued employee also. She's actually extremely skilled in radiology. She's one of my best teachers of radiology safety, as well as positioning and taking x-rays. Since she took the class, she has been it's been a little bit easier to give her instructions on what films to take, because she now knows the anatomy of where to place the dog and where to place the beam in taking the films. So I'm not having to dumb it down as I do for some of my staff by saying ankle instead of hock, etc. So that's been really good. The safety standards, of course, she has been observing the whole time.